After starting Sinopril, I have developed dry cough which is very irritating and is not getting better with any medicine. What should I do now? Sinopril may cause dry cough, as a side effect in some people. This can be persistent and may not be relieved by any medicine. Talk to your doctor if it bothers you or if you have trouble sleeping. Your doctor may suggest ways of managing the cough or may prescribe another medicine. Remember, do not stop taking Sinopril without consulting your doctor as it may increase your blood pressure and put you at a risk of developing a heart attack or stroke. Even if you stop taking Sinopril, the cough may take a few days to a month to resolve completely.